Dr. Moak. I have a question about Botox that we hear today. There has been conversations in the media that certain establishments call it Botox, but they may use a different toxin. Can you give an opinion on which you use and why?
I'll review that, but I'll review kind of all the neurotoxins that are currently available in the United States. So Botox came out first in 2003, and it was specifically for the glabella, which is right between the eyes. And it was approved for, they did 20 units at the time, which turns out that's not the right dose. It should be 30, but it's 20 units between the eyes. And that was the first indication. We learned how to use it in other spots at that time. They then subsequently got the indication for the wrinkles around the eyes, or the so-called crow's feet, and then about 10 years later. And then in 2017, they had the indication for the forehead. Now, we've been treating all those areas all that time, but that's when they got the FDA approvals for them. Next one to come out was Dysport. Dysport came out right about 2009. And Dysport is the most dissimilar of the neurotoxins that are out there. Most of them are almost identical to Botox. Dysport's the furthest away. And the units don't even match up. So 1 unit of Botox is equal to about 2.7 units of Dysport. The Dysport has a nice ability to spread. It spreads much further than Botox. Imagine if you inject Botox and spread the size of a dime, then Dysport might be the size of a nickel or a quarter. So that leaves the pros and cons, where most places you might want spread, it would be desirable. Places where we want precision, not desirable. I never got a brow lift with Dysport in our patients. So for that reason, I choose not to use it. Arguably, it would be great for the forehead. 2011, out came Xeomin. Now, Xeomin came out for a very specific indication. It was what they would call a cleaner toxin. It's an oxymoron, but these are toxins. The most potent toxin known to man is the Botox brand. Of course, we're using minute doses. And some people get antibodies to the neurotoxin where it stops working. And it's very rare in cosmetic indications, but for medical indications, we're using much higher uses. Bear in mind that most toxins are paid for by insurance for medical uses, muscle spasm, torticollis, that sort of thing. And they get immune to it. They don't get allergic, get immune to it, and eventually it doesn't work. So Xeomin took the toxin, which is very small. It's called 150 kilodaltons, and has a 750 kilodalton core around it. That's what Botox is. Xeomin pulled that core off, and this has the ideal toxin. So really, that might be suitable for people that are using more units, or people starting very young. They'll never get resistant to Botox. In those three toxins, we had the most experience with, been around the longest. And I'll tell you, if we can compare the newer ones to those three, because they fall in line. The Botox is kind of in the middle of the spread. Xeomin is the lowest spreading, the most precise, and Dysport is the least precise, most spreading. And when we talk about what is our preferred one, well, it depends on what we're treating. Okay, so I don't use Dysport, not because it's not a great toxin. It does create some product confusion because the units aren't the same and it has a lot of spread. But I think that would be a suitable toxin for the forehead, where we want spread in a low number of units. We do use Botox for the forehead because we want the spread in the forehead, and we do not want precision. The forehead is the muscle that you can most easily, say, screw up. When people look fake, they've had their forehead over-treated. And Botox really delivers well because it spreads a decent amount. It's very predictable, and it causes softness. Where I like Xeomin the best is where I want precision, which is specifically for improving the brow position, the eyebrow position. So we put Xeomin here and here where we want to lift the brows up. The brows drop over time because most of your muscles of facial expression pull your eyes down and make you look pissed off, tired, angry, which is undesirable. And we want those weakened. But if we use Botox here or this part here, it bleeds into the lower forehead, and it prevents the brow from lifting very much. In fact, it might drop the brow. So when we see that called quote-unquote Spock brow, where somebody's brows like this here, that sometimes is from something like Dysport here that spreads a lot, or from overdoing the forehead, center forehead. So we don't really have a preferred one. It depends on where we're at, but we typically in our practice use Xeomin and Botox. We don't use all Botox or all Xeomin. We use Botox in the frontalis muscle of the forehead and Xeomin on the glabella and the orbicularis muscle, where we want precision. Let's go further from that. Then out came 2019, Jeuveau. And Jeuveau was designed to overcome one of the limitations to the toxins. They don't have any insurance indications, so they can, mess with the price more. It allows them to bring the price down. So I think that's put a little bit downward pressure on pricing of toxins. Not a lot of good studies on it comparing to other toxins, but it appears to have spread similar to Xeomin, more precise. So we might use in the same areas. Then there's the Daxxify that came out in about 22. Daxxify is the one that they first purported to be a 6-month neurotoxin. Turns out that's not the case. Some people do get the 6 month, but you can get 6 month with Xeomin or Botox too. And you need twice as many units, so it's not as powerful. That one I don't think has caught consumer attention because you're paying more for it, you need more units, and it's some people it's very highly variable how long it lasts. Then Latibo just came out last month. It appears this last year, and it appears to be a shorter acting neurotoxin. So that being said, let's do a summary. They all work great. There's miracles. Whoever came out first would have been the leader, and that was Botox. And Botox is almost like a generic name, like Kleenex is the facial tissues. But we use internally we call it a toxin because there's different types you might use, and I think you can interchange them to some degree. But typically, where you want spread and smooth, we want Botox or Dysport, and we want precision and lift, we want Xeomin or Jeuveau. Daxxify is pretty precise as well. I just don't like it because of the unpredictable nature. Now, there's something called a dose duration curve, and the more units used, does it last longer? Well, that is the case with some of them, but not all of them. Botox doesn't have a very strong dose duration curve. Xeomin does. So I like that as well. Also, Xeomin on average, if you use the same number of units as Botox, you're gonna get about 2 weeks more out of it, maybe even 3 weeks more out of it. So it gives the advantage of lasting a little longer. In fact, historically, we used to schedule patients for Botox every 3 months. And we started putting Xeomin in the glabella and the orbicularis, we moved people out to 4 months. So it actually saves them, a treatment a year basically, or treatment every 2 years. So they all work great. I have preferences based on some practicalities. Again, Dysport, I think that's a great neurotoxin. We don't use it because there is confusion with the units and it's uncontrollable in the spread, which might make it great for the forehead, maybe not so great for other areas.